We're here at Dr.Max Restoration Center in Fort Lauderdale, Florida. We're going live again. We're gonna try to make this as a tradition, maybe once a week, as long as the schedule allows this. Um, we're live on both YouTube and Instagram. And traditionally, what we're trying to do here is to review some of the commonly asked questions, and questions are being taken from support forums. Hair loss is an emotional problem for both men and women, and a lot of time people get really desperate in finding answers, solutions, because hair loss affects us psychologically, and because hair loss is a progressive condition, it's a chronic condition, it's usually getting worse over time. So knowing what to do, knowing what works, what doesn't work is essential, because if you start investing time and money in something that not really proven to do any good for you, for the cause of your hair loss, you basically wasting both. You're wasting your time and money, and this is not something that can be restored easily. Not time, money probably yes, but time and progression of the hair loss, if we not fast, not quick to react and start on a proper treatment, definitely it's going to be more challenging later. So there are private groups, support groups, there are public, and of course, anytime you have something like this going on, we have a lot of different opportunistic companies that are trying to sell their products, and they try to make every effort to make it more convincing so people buy their products. The question is whether it's actually do something instead of enriching those people who are trying to sell it. So we'll try to go over some commonly questions, and these are questions from real people. And today we'll try to concentrate on specifically on female pattern hair loss, or female hair loss in general, because it's a big topic. It's very complex. There is no perfect solution, and diagnostic approach is very important. If the condition is not diagnosed properly, then of course we can cause damage to existing hair follicles, and waste the time. So let's start. So one of the questions here is, so frustrated with my hair. It has been thinning since late 2020. This person is 42 years old. It's not hormones, it's not thyroid related. My doctor thinks I have alopecia. I see dermatologist next week. This person is on biotin, collagen, hair thickening shampoo, castor oil, rosemary oil, clarifying shampoo. What can I expect from dermatologist? Who does steroid shots? Does it help? Did it make you gain weight? So there's a lot of questions here, and I think these questions are asked to in their own environment. Okay, so steroid shots are used to treat a particular type of hair loss, an autoimmune type of alopecias, or scarring alopecias, or non-scarring alopecias like alopecia areata. And steroid shots is not a first-line treatment, period. this is something that could be discussed once the diagnosis is made. Let's quickly talk what is a scar in alopecia. And it's very important, especially with women, because in female population we have a high incidence of autoimmune type of hair loss. And it has to be properly diagnosed and diagnosed quickly, because scarring alopecias are usually non-recoverable. Once the hair follicle is damaged and there's a scar tissue develops, there's no way we can bring back. And the hair transplant is not, absolutely not, the first choice. Yes, it could be an option later, but with scarring alopecia, such as lichen planopilaris, such as frontal fibrosis alopecia, such as CCCA or centrocentrifugal cicatricial alopecia. There are more, but these three are the most common ones. We need to make a diagnosis. It could be done either by looking with the trichoscopy, so something what we have here in the office. And the first thing I do, especially with female patient, I conduct a really thorough microanalysis of hair follicles. And I look specifically around for the what we call the perifollicular inflammation. This is the redness around the shaft of the hair. There are other signs, depends on, but this is something that we need to be aware. If I have any suspicion, I will contact my colleagues. Again, I do surgical, non-surgical hair restoration, but I prefer that my colleagues, like dermatologists with experience in autoimmune type of alopecia, will take care of this patient. And once the condition is stabilized and we know there's no remission for a year or two, then we can consider a hair transplant. So before you start making comments of somebody asking, I have this hair loss, well, let's do the saw palmetto, let's do something else, let's do peppermint oil. Again, it's important to diagnose condition properly, and then, we can, if it's something that can be treated differently, we can consider that. So hair thickening shampoo, going back to this question, biotin. So biotin is the vitamin that does help to stimulate hair growth. Question is, with biotin, whether we need it. Okay, vitamins only work when there is a deficiency in vitamins. If we are on balanced Western diet, we eat right, we eat proper things, and our biotin levels are normal. If we take extra biotin, it's not going to do much. It will be excreted just like anything else, that our body is very smart. So any vitamin that is already there, normal level, is not going to do anything extra. So there is absolutely zero proof that extra vitamins will help with anything unless we're deficient. So castor oil, rosemary oil, and clarifying shampoo. Castor oil, rosemary oil, yes, I mean, you can see some, even if you look on PubMed, there is some evidence, what they call anecdotal evidence, right? What that means, anecdotal evidence, that there's some clinic or somebody who does a limited research, they reports this type of study, that certain oil can help with hair growth. Question is, how valid is this study? In order for study to be valid, it has to be validated by multiple centers. They have to run what they call the randomized double-blinded study that validated on both sides, and they have to run two groups and compare the results. Okay, so a lot of time we don't see this type of evidence, and you have to be pretty skeptical to just follow. Again, I don't see that being harmful to use, but I wouldn't recommend as a mainstream therapy. Okay. So next question is, I started minoxidil 14 days ago and am now experiencing shedding. Is this normal? Yes. So if you start minoxidil either over the counter or it was recommended by your physician, you should expect shedding phase that lasts between, usually starts around 4 weeks and get a little worse after 2 or 3 weeks. It is usually stabilizing, and some doctor actually think that shedding of the hair is a good prognostic factor, because what happens during the shedding phase is what we call telogen phase induction. So minoxidil will push some of the hair into the early resting phase, telogen phase, and after a few months, it comes back as an anagen hair, and anagen hair, that's what we actually see to the naked eye. So it's definitely nothing to be concerned if you have a shedding after you start minoxidil. We can see it frequently. Next question is that we found is, did anyone manage to grow hair without minoxidil / Rogaine? So again, and here's similar question. I guess the person who was asking the question is there a more natural way to regrow the hair or to grow hair? So, and mentioned castor oil, rosemary oil, and microneedling. So castor oil, rosemary oil maybe or may not have some helpful action with hair growth, but it still remains unclear. What is different about minoxidil or brand name Rogaine, that the medication underwent very strict controlled trials, and we know for sure it does work. So my suggestion is, if you are thinking about more natural like castor oil, peppermint oil, rosemary, don't stop minoxidil. You can do it in addition as a combination treatment. It may be or may not, it gives some additional benefits, but minoxidil, we know 100% that it is effective in certain, again, not with every type of hair loss, but with androgenetic alopecia, both men and women. Next reply. I did experience alopecia areata 1.5 years ago. I did a few things, not sure what helped most. I went to the dermatologist and received injection. I was prescribed ketoconazole shampoo. I used it occasionally. I used to wash my hair daily, now 2 to 3 times a week. I reduced the heat of the water. I used Nutrafol. I started oiling my hair prior to washing and tried to reduce my stress by working out, controlling my thoughts. I can't point it to anyone because I did many, but I have no more bald spots. My hair is not where it was before, but it has improved drastically. Good. So this is completely different. It's actually a reply to the question whether did anyone manage to grow hair without minoxidil or Rogaine. But the reply, the patient, I'm sorry, but the person mentioned that she had an alopecia areata. So alopecia areata is completely different. It's a different turf, different type of hair loss. It's unrelated to minoxidil, because minoxidil is the female pattern hair loss. Alopecia areata is completely different. Alopecia areata is autoimmune condition where the hair follicles, instead of being damaged at the level what they call the scar, it's called a non-scarring alopecia, right? They've been damaged lower, and it usually responds well to steroidal injection. Now there is a medication that can be prescribed It's an immunomodulator that can be helpful, but it has to be prescribed by a doctor. Okay, so with alopecia areata, again, different type of alopecia, stress is one of the risk factors. So people with history of alopecia areata, stressful event can trigger a flare up with the with those patches. It usually look like small coin-like lesions, round lesions. This is the most common. There could be different uh, variations of alopecia, but this is the most common. And definitely ketoconazole, it's a great product. Ketoconazole shampoo can be prescribed by your physician even for androgenetic alopecia because it does fight inflammation. And inflammation always, almost always, can be harmful to your hair follicles. And ketoconazole helps with seborrheic dermatitis, which, by the way, brings the inflammation, and that's the reason why we prescribe it. So Nutrafol, again, Nutrafol vitamins, unless you're deficient, I don't see how it might help. And reduce my stress by working out, yoga, controlling my thoughts, absolutely right approach. By the way, reducing stress not only helps with hair, but helping with a lot of different causes of our illness. Okay, stress by itself will part of our normal body reaction to stress. We release stress hormone, cortisol, and cortisol can cause weight gain, can cause hair loss, can cause reduction in immune response. So all this, so reduction of stress, this is very healthy, very proper approach, and I would recommend it to everybody. Okay, so yoga and working out, very important. It is known people who are in good physical shape, they suffer less from stress and other conditions. Okay. Next question. Female hair loss inquiry. I'm currently experiencing hair loss like never before. I have been losing small amounts of the hairline after I gave birth for the first time. Figured it was the postpartum hair loss, which it really was. Then on my second child, I gained a lot of weight. Right now, I lost 44 pounds, but also 70% of my hair. I'm wondering how to manage it to stop hair falling out. There are growths, but even those baby hairs easily fall out. I have been taking collagen and biotin and other supplements, but it's still thinning day by day. So this is a different topic. It's related to postpartum hair loss. Postpartum hair loss, just what we just talked, stress. Stress, release of cortisol, other factors will predispose our hair to telogen effluvium. It's a rapid shedding. This is not a permanent hair loss if it is really stress related, but your doctor can determine that. But it should recover. Once the stress factor is removed, it should recover. Some things that could be done to prevent it. If prior to, you can schedule some things, of course, during pregnancy, there's not much you can do. I don't recommend doing a PRP during pregnancy. I don't recommend taking medications such as minoxidil during pregnancy because childbirth is the most important thing, and you don't want to endanger your child, your future child health with these medications. But as soon as you're done, postpartum, after birth, we can do PRP. It's not, you can breastfeed after PRP, that's not a problem. Okay, you can start minoxidil. I think it's pretty, at least topically. And of course, it has to be determined by your doctor whether it's appropriate. Okay, and the sooner you start after the late after childbirth, the better the consequences are. So, but again, if it's stress related hair loss, it should come back. It takes time, 6, 7, 8, up to a year, but usually it returns back to normal. And especially once the hormones during breastfeeding, there's a lot of prolactin hormone release, and it definitely can affect the density of the hair loss and stress. So once everything is passed with the breastfeeding, it should come back slowly. Okay, so people mention next question. And by the way, if you have any questions to ask, feel free. I can see it here in the comments and I will respond. People mention Mama Earth onion shampoo, enriched with natural goodness of onion, plant keratin, wheat amino acids, soy amino acid that help to control hair fall and promote hair growth. All right, so my personal take on shampoos, they do not work, okay? Because shampoos they made to clean the hair. So you apply the shampoo and then you rinse it off. So if you think logically, how exactly it will exert the action on something that below the skin. When you treat hair loss conditions, you do not treat your existing hair, you treat what is below the skin, you treat the hair follicle. And hair follicle is about 4 millimeters below the skin surface. So when you apply shampoo, you clean your hair, then you rinse it off, and it goes down the drain. So I don't think it's any type of Mama Earth shampoo with plant keratin, wheat amino acid, and soy amino acid will do any good. Exception is ketoconazole shampoo. So ketoconazole shampoo, when we prescribe it, we recommend to use it, to leave it to 6-7 minutes on the scalp so it has time to work on the scalp, not on the hair. Okay, so hope it answers and clarifies everything regarding shampoos. So next question is, 60 years old, has been losing hair for past 2 years because of COVID and weight loss. What are the best options? So there's two different conditions, COVID and weight loss. So weight loss medication is not specified what's causing the weight loss. If it's self-induced weight loss, using one of these newer medications, injectable, and COVID. So COVID does have some association. It's unclear whether it is a direct autoimmune condition, and there are reports in literature about COVID-induced autoimmune hair loss, because COVID by itself triggers our immune response. Sometimes our immune system will be triggered enough to develop autoantibodies that can damage hair follicles. So I've seen myself patient with lichen planopilaris that never had it before, and after COVID developed that. So it's definitely an option. So when we talk about COVID-related hair loss, it's important to seek a professional attention, professional help with dermatology, hair transplant surgeon, hair restoration facilities. Again, I don't know about trichologists because there's no licensing authority for trichologists. So trichologists is sort of a self-proclaimed thing. I can say, oh, I read this many books about hair loss, so I call myself a trichologist. Okay, but there's no enforcing board of trichology per se, right? So I think you in better situation looking somebody with a medical license who specializes in dermatology, hair loss disease, and so on. Okay, and so this is answer about COVID. Weight loss medications are known. We don't know what exactly happens, and why it happens. but we've seen it's a relatively new topic, but we've seen some um, correlation between starting on weight loss medications and having hair loss. We don't know if it's temporary, if it's permanent. Um, there are some suggestions what to do. Again, I think PRP, it's a stimulative treatment. So if you're thinking about starting on weight loss medication like Manjaro, um, you might want to think about doing something to stimulate your hair. Minoxidil, by the way, or Rogaine is stimulating treatment. It increases blood flow to the area. It's a vasodilator originally. It increases blood flow to the scalp, and it helps to sustain anagen phase of the hair follicles. So this, again, remember, anagen phase is where the hair follicles are visible and you can actually see them. Telogen hair, it's very fine. You can hardly see it. It's non-existent temporarily. Okay, so I hope it answers. And I think if you consider going on the weight loss injectable therapy as it becomes very popular, talk to dermatologist, talk to hair loss doctor to see if you can do something to prevent it. If you start with stimulating therapy, you might not experience as much of this hair loss, so you don't have to chase it later. So, hi everyone. That's the next. We're going to the next topic. And again, you're free to ask questions. Can I see it here? Live chat. This one? Mm-hmm. Okay, live chat. Okay. All right. Okay. So next one. Hi everyone. I'm a female. Experienced severe overall hair shedding after HRT pellets. The endocrinologist thinks it's cause of my testosterone levels are very high and converting to DHT. Testosterone will eventually leave my system, but could be a long time. Question: are red light helmets heads legit? If so, can you recommend a good one? I've also started topical treatments, Nutrafol and PRP. I'm desperate to stop the shedding and regrow hair. I'll do anything. Thank you. Okay, so here's the data that I have. I don't know how old is the patient. So I assume the person, if start on HRT pellets, probably postmenopausal. But it could be it become more popular for small testosterone pellets for women pre-menopausal age, even before the menses still to exist. It does help with energy levels and mental clarity and other issues. So it becomes more popular, right? Question is how high the testosterone gets after the pellets are being placed. What is specific about pellets? Pellets is basically it's a tiny cylinder-like pure testosterone that being deposited under the skin in the gluteal area. These pellets stay there until they completely dissolve. And it could take up to 4 months. Sometimes a little bit less, sometimes more. So can you see more shedding with pellets? Yes. How bad it is, it's hard to tell. So what is really important is not even the DHT level as was mentioned in this question, but how sensitive we are to DHT. So in this case, again, it's important to talk to someone who is professional, qualified in hair loss, medical doctor, provider. There are some options what you can do. You can prescribe topical. It's off-label. We can prescribe topical finasteride, for example, to limit conversion of testosterone into DHT and protect hair follicles. Okay, it's a very common option. Question specifically, are red light helmets hats legit? So, good question. So there's a red light and there's a laser, and these are two different things. This is the when we talk about red light, it's basically any LED of red color will provide a certain length of the optical spectrum, and it's not really honestly doing anything. Okay, so when the question is about low level laser therapy, it is different. A low laser therapy was evaluated. It has FDA clearance of 501K FDA clearance. What that means that this type of therapy was clinically evaluated and was found to be valid. That means when there is a claim that something does certain things, there is a validity because it was checked and is validated by an independent um, uh, board such as FDA, Food and Drug Administration. So it definitely can help. Would I say that's the only thing that you need? Probably not, because again, we have a hair loss is a multifactorial condition, and that's how we treat it. We try different combinations of things. So Nutrafol, again, Nutrafol will not harm. I'm not sure how much it could help. It's different multivitamins. PRP, again, what about PRP? So let's talk a little bit about PRP. PRP is, there's no strict protocol how PRP is being prepared, how being injected, and what is PRP, what percentage of leukocyte, what percentage of platelets, and every place will have different concentrations, different protocols. So it's very hard to tell PRP will help because I don't know where this PRP is done, how professionally it's prepared, how professionally it's been injected. So before you decide that you do want to do your PRP, please investigate who does it, how prepare, and maybe one day we'll have a topic about PRP and we'll go into much more details, and it will help you to maybe make a right decision whether you want to do it and where you want to do it. Okay, so but this is something to be aware that there is no equal. PRP is not equal everywhere. Next question is: did you have any questions so far? Let me check here. Okay, so here's a question from Boyd's Medicine. If I get hair transplant, sorry, it's live, and sometimes things go, okay, now I hope it doesn't disappear. How fast can I start my regular life, like exercise, swimming, and sunbathing? Okay, good question. So hair transplant will limit you typically for a few days. Right? What do you want to avoid out of a hair transplant? No swimming, and I do not recommend swimming in the pool because of the chlorine levels for at least 2 to 3 weeks. Better 3 weeks, because again, chlorine, it's a toxic substance, and it's frequently added to the pool water, and it could hurt your grafts. Okay, so swimming in the lake, probably not a good idea because again, it's a fresh water. There's bacteria there. There's all kind of things, and ocean swimming, I think probably the safest. I would tell between 7 to 10 days. Has to be, the area needs to be evaluated that is back to normal, and yeah, 7 to 10 days. 10 days to be on the safe side. Okay, you want to protect your hair recipient area for at least 3 to 4 months from direct sun exposure. UV exposure can hurt your hair follicles. UV radiation is known to damage skin. So it's very easy. Just wear a hat when you're exposed to sun directly, or if its area is open, you can use just regular sunblock. Remember, sunblocks needs to be applied every 2 hours. They lose efficiency after 2 hours, and we need to reapply them. Otherwise, there's no point of using them if we just do it once a day. So, exercising, I recommend at least, again, 7 to 10 days. And the reason is because of the hair transplant, we want to provide as much blood flow to the recipient area as possible. If I had my hair transplant right here, and I go to the gym after 5 days and I start to do my biceps curls, right? What's gonna happen? So during exercise, my heart start increasing the cardiac output. Okay, heart rate is increasing and the contraction is increasing, right? And why does it do it? Because these muscles that get exercised, they require more blood flow. And what our body does, it switches from non-essential areas like our skin to more essential areas during exercise. And it's not something that, at least in theory, we want to expose our grafts. Our grafts needs to have as much oxygen, as much blood flow during the recovery period. So I recommend 7 to 10 days, no heavy exercise. Walking is okay, working in the office or light work is perfectly fine. I had surgeons, orthopedic surgeons, doctors who had their surgery and they went straight next day because we doctors, we have busy lives, and we cannot really take a week or 2 weeks off because the patients are waiting for them to come back. So they did just fine as long as you follow your instructions. Of course, first few days you want to protect the grafted area, the recipient area, from any physical impact, because nothing is holding this graft in place until all the regenerative healing occurs and they already anchored. So any physical impact can displace some of the grafts. Okay, next one. Okay. So last one. Okay, we talk about testosterone, DHT, laser therapy. Next question. I have AGA. AGA stands for androgenetic alopecia. And I just started oral minoxidil about 7 to 8 weeks ago, but haven't noticed real shed, which usually signifies it's working. I was already on spironolactone and Rogaine, so could that be why there's a little shed, but could mean the minoxidil is still working? So it's kind of really strange question, because this person asked, I started oral minoxidil, right? But he or she continues with the Rogaine, which is the topical minoxidil, right? So I would not do it both at the same time, but most likely there is not going to be a shedding phase if there was before. Hopefully this person stopped topical minoxidil before starting oral minoxidil. And I would say probably there's no shedding, or at least very noticeable shedding if this person been already on minoxidil for some time. Okay, and spironolactone, I guess spironolactone is probably female. That's what usually prescribes anti-androgenic medication. It reduces testosterone level in general, androgens. So yes, it's probably what it is. Next question, which works better, spray minoxidil or drops? Good question, and hopefully I have this bottle here that I can show. All right, so here's one of the options we have to offer for hair loss prevention. We have both female and male formulas, and I prefer drops. Why I prefer drops? Because if I have this hair, right, and I take this bottle of spray and I try to spray here, right, most of the actual medication will land on my hair. And landing on my hair doesn't do anything to treat the cause of the hair loss, because the cause of hair loss, as already mentioned during this live session, is below the skin. We treat follicles. We treat what is the bulb of the hair follicle, right? And the bulge area. We treat areas where the proliferation of hair follicles happen. So I prefer drops. And the way I use it, so this one, for example, has dutasteride, melatonin, um, biotin, and minoxidil. So it's sort of it has everything that is clinically proven. Again, biotin, we decided, okay, we're gonna add biotin because it's not gonna hurt, but it's one of the vitamins that does stimulate hair growth. So when I use it, I like a dropper because I can apply it directly to my scalp. Okay, I like to hold it with a little angle like this, so I can slide it and squeeze the bulb gently and spread the entire solution everywhere. Okay, so you want to treat your crown area, you want to treat your good areas along with affected areas, because it is a preventive therapy. Then I use this silicone massager brush to further spread the medication in the scalp. So I hope it answers. I think much, much more efficient to use drops versus sprays. So you don't have to waste your product, right? Okay. So how does microneedling promote growth? Well, good question. And of course, you can see all these companies on Amazon and Facebook forums. They promote brushes, microneedling brushes. Here's my view, and you might agree, might disagree. Microneedling can help as long as it's been done in controlled environment. Because if you go too deep and you have thousands of needles, you can actually damage some of the hair follicles irreversibly. Okay, the point of using microneedling is to cause a micro trauma to the superficial layers of the scalp. What microtrauma does, it's exactly why we do the PRP. So in PRP, instead of using traumatizing the skin, we inject activated growth factors directly to hair follicles, and it seemed to do what it's supposed to do with PRP. With microneedling, what we do, we hoping we're going to cause enough damage to superficially without damaging hair follicles, and and that's how our body operates, right? If we have damage to something, it will recruit, it will send all these signals, so platelets will try to get to the site of the injury, accumulate, and they start the repair process, right? And they release all these growth factors. So all these reports about microneedling helping with hair loss might have a validity. The problem is you don't know what quality are you getting of this microneedling device. If it goes too deep, or your hair follicles are too shallow, instead of 4 millimeter, they at 3 or sometimes even less below the skin surface, you can cause some irreversible damage. So my personal advice, not to do it unless you're completely sure. Or you can, again, seek advice from qualified professional medical provider. Okay. Next question. What are the best tips for healthy hair for women? So the best tips, and I don't know if I can summarize everything. Um, Live a healthy, balanced life. Um, Beware if changes occur and if something is not normal, please try to get it evaluated by a medical provider. Um, my personal advice is to, and I know I might be, uh, uh, some of the hair salons will not like it, but I advise against all these traumatizing hair treatments like drying your hair, bleaching your hair, uh, keratin, because they ultimately, if we're talking about hair structure, hair above the skin is not a living structure. So there's no repair mechanism. Once something, some of the heating structure was damaged, there's no way you can, unless the new hair, I mean, the continuous growth will substitute it, there's no way you can repair. So I know when you do keratin treatment, it looks good for a month or two, and then after that, you see how much hair is dehydrated, how much it becomes breakable, and so on. So my personal, the less stuff you do to your hair, the better overall you're gonna see the results. So I, I've seen even with my wife. She used to bleach her hair, but she stopped doing it, and her hair looks absolutely amazing. I know she's watching me now. I hope I describe it correctly. Anyway, so we have a couple more questions. How we're doing with the time now? Okay, so yeah, so we have another 50 minutes. Usually we do 1 hour. Again, if you have questions here, you can ask them. Let me see. For some reason, this live chat. Okay, all right. Sorry. Okay. Next one. I have thin hair and love my hair extension. Do hair extension cause hair loss? Great question. So, hair extension will cause more hair loss. The longer you have hair extension, the more hair loss you're going to have. Okay? And please remember it before you make a decision. I know we're looking for a fast solution to the hair loss, going to look better. The problem is that if you decide you go to a specialist, you want to have hair extension placed, the reason is that your hair is already weak, that your hair is thinning, the density is not where it used to be, and you try to sort of patch and look better, right? The problem is this hair extension have some weight. They create a pulling force, and it's called attraction alopecia. The hair is already thinning, the hair is already suffering, and then you bring another stress by getting these extensions to the hair, and it will cause it sort of it will make it worse over time. And I think if this happens, first we need to try to determine what's causing hair loss, start on the proper therapy, and hopefully it will recover. Okay. My next question. Yeah, today we're talking about, mostly about female pattern hair loss. My hair is very curly, and I use keratin to keep it in shape. Do keratin and other hair straighteners cause problems for hair? Yes, I assume this keratin is applied by when you go to your hair salon, right? Yes, absolutely. It will damage to irreversibly damage your hair. Your hair will become more breakable. and it will not in every time you try to use another treatment, there is hair becomes shorter and it's going to look dry, and there's no way to repair it. So um, this is kind of a decision, hard to give an advice, but you know what I can tell that keratin treatments with this hot comb that been done in hair places that can definitely cause some damage. Next question. Like hot flashes were not enough. Now my hair looks thin and I literally can do anything to style it. Is it just a phase? Effect of the menopause for hair. So, good question. As you know, we all change. We all, we especially with age. And one of the changes that do occur naturally is our hormonal changes. For men, it is less noticeable because there's no clear man equivalent of menopause. But for women, it is very clear. So once what happens during childbearing age, that women ovaries produce estrogen. Estrogen actually helps to sustain growing phase of the hair follicles. And when the menopausal changes occur, it's a failure atrophy of ovaries. Ovaries become less active, estrogen levels start to decline slowly, and then as a result, at a certain point, menstruation discontinues, and this is officially considered to be a menopause. At this time, what happens are the changes. The FSH, it's called the follicle stimulating hormone, is actually going up while estradiol goes down. Why FSH, follicle stimulating hormone, goes up? Because it's the hormone that stimulate follicles. That's what it is called, follicle stimulating hormone, FSH. It is produced by the brain, and once it senses that estradiol is low, it tries to stimulate it. And this is how we diagnose menopause in women, is by a decline in estradiol and increase in FSH. So estrogen is responsible for prolongation. There are receptors in hair follicles, and that's why I mentioned previously hair loss in women is more complex. It's not, we cannot really call it androgenetic alopecia because it's not only androgen related. There is a lot of, it is more complex, and it treated as such. Okay, so hair transplant is not always the right answer for female hair loss, but not getting again evaluation and proper treatment. It could be thyroid related, could be related to polycystic ovarian syndrome. There's a lot of different reasons, autoimmune alopecia and so on. So with menopause, estrogen declines, and as a result, women can see more progression of the hair loss. There are options to treat. It could be hormonal replacement, and with hot flashes, many women and prefer this type of options. Medications, low laser therapy, and sometimes even hair transplant can help. If it's clearly endogenetic related type of or female pattern hair loss, we can do a hair transplant, taking stronger hair follicles from the back, from this area, okay? And with women, we don't have to shave. With women, we can do what we call a no-shave procedure and restore. And I did probably 20% of my patients are women, 20 to 25, and it's definitely doable. Okay, another question is, Oh, okay. It was message was retracted. Okay, so how are we doing with time?
It's been 54 minutes.
54 minutes. Okay. So there's a okay. So 6 more minutes for us to be done with the live session. Okay. So here's alopecia androgenetica. Who has this and who have found any hair solutions? So again, this is one of the questions from the forums, and it I think it's refers to female pattern hair loss. And one of the replies here, so we're not going to only read questions, sometimes we can read replies and see if there's any validity to in recommendations that are given plentiful on these forums. So one of the replies was, the genetic alopecia is what I was told I have. Have tried many things over years. I'm currently using saw palmetto as DHT blocker as well as some other vitamins. DHT blocking shampoo. We discussed what DHT blocking shampoo does nothing. As well as rosemary oil shampoo, Dermalor, same thing. Shampoo, nothing is really proven to work. Rosemary oil, Dermaroller, and minoxidil. I'm finally starting to see some new growth on top. Highly significant mainly from Dermaroller, as well as I wasn't using it. I didn't see any growth. Okay, so yes, from all being told, all being said here, saw palmetto could be some DHT blocker, but you cannot rely on this as just a salt therapy. So minoxidil will be important. Dermalor roller, again, I would be very cautious with that. And yes, I think that's pretty much it. Are we okay? We have more.
56 minutes.
56 minutes. Okay. So next question. My hair has been falling out for over 10 years, and now it is worse. All right. Sorry, we are live, and I think right now it's just okay. Let me fix this. Okay, are we back? Okay, good. Let me put it here. So sometimes what happens when you, yeah, yeah. Mm-hmm. So when you live, things could happen, could go wrong. But we're okay. We're back there. So 10 years of hair loss and it's getting worse. It's so thin, it doesn't grow at all. What do I do? I'm so debilitated from it. So some of the replies, and this is where it gets interesting. Try steaming your hair. Steaming enhances the overall health of your hair and scalp. It also enhances blood circulation in the scalp. Well, not sure. I think steaming can actually hurt and cause some burns. Okay, so please do not try to steam your hair. Okay, it's not going to help. It's not going to. If it increases some blood stimulation, blood circulation, it just for a few minutes while you apply something warm to it. Okay, so I don't think that this is something you should rely. Okay, then interesting advice here. So it says you must apply 40 days every day coconut, rosemary oil, and peppermint oil. After 40 days, you will see how much has changed. Attention, please. 3 tablespoons of rosemary oil, 10 drops of essential peppermint oil, 10 drops of essential rosemary oil. Let's do it. Okay. Well, sorry, I don't want to use other words, but you're not going to see changes in 40 days. Okay. Even let's assume that this magic mixture of different oils is really working. Okay. Hair, once it's thinning, will take at least 6 months to transform. So 40 days, I can assure with every with all my experience in treating specifically hair loss, it will not happen. Okay, it takes much longer. Hair grows only 0.9 centimeter per month. So if you have a thinning, miniaturized hair follicle, once you start the treatment and it starts thicken, it will take at least 6 months to reach 6 centimeter. And what is 6 centimeter? It's just like this. Okay, so 40 days. This is absolutely this is advice that should not be taken, and it's not going to help at all. Okay, so ask your another suggestion. Ask your doctor for a full blood count. You may be deficient in vitamins and iron. Make sure you get your ferritin level checked, and also your thyroid. Actually, that's a good idea. Okay, so blood count, anemia can cause hair loss. Deficiency in thyroid, T3, T4 needs to be checked, can cause hair loss. So iron could be anemia, right? So if iron levels are low, it can lead to to anemia, low hemoglobin levels, and definitely can lead to hair loss. This is one of the I should give a credit, good advice. My mom started to lose her hair. That's another advice on the same topic. My mom started to lose her hair when she moved to a different state, and the water there made at her made the water when she moved to a different state made all her hair fall out. Then she got the water filter installed, and instantly she noticed a difference. Well, instantly nothing happens with hair. This is very important. So when you expecting a treatment or some action that you do and you have instantly improvement, this is not how it actually happens in life. Hair have to grow long. You need to do something to treat your hair. They have to wait until this treated thicker hair grows long enough so you can see the difference. I would theoretically, yes. Some components in drinking water can cause some toxicity potentially. Okay, but I doubt. Okay, usually water is being tested for quality. So if there is increase of lead levels or some type of unsafe chemical, it will be treated. How many of us actually drinking water? Probably not too many. We all drink either bottled water or distilled water. So it could be or could not. I cannot really tell. We'll probably, once the water report is available, it's possible to determine. Anyway, I think we're about an hour right now. Okay, I hope it was helpful. It will be available for some people to watch. I try to go over as many topics as I can, and we'll try to stick to the schedule. Depends on our surgical schedule. Sometimes I'm too busy with surgeries. This week it happened that I have more time available, and I'll try to look for some interesting questions and interesting answers. And I think that's the best way to look into a real world environment and to see what actually works. Should you follow advice or you should not? But any question, don't hesitate to contact us. I love talking to my patients. You can come see me and have a complete evaluation for causes of the hair loss. Thank you very much for watching, and we'll be in touch soon next week. Okay, I click on live here. Okay. All right. YouTube.